Hi, my name is Alyssa Gibbons, and today I'm going to be talking about lupus. I'm sure you're asking, well, what is lupus exactly? Well, that's what I'm here for. Lupus is a chronic autoimmune disease, and what happens is the body's immune system attacks its own healthy tissues and organs. This will lead to inflammation and damage across multiple systems, which include skin, joints, kidneys, heart, lungs, and nervous system. The most common and most serious type of is systemic lupus erythematosus, which is also known as SLE. This type is so serious because it affects any organ system. DLE does not usually affect any internal organs, but it does affect the skin, causing redness and scaly patches. Subacute cutaneous lupus will cause non-scarring red lesions, and it is often triggered by the sun. Drug-induced lupus is caused by medications such as hydralazine and others. Symptoms will typically stop after the person stops taking the drug. Lastly, neonatal lupus. This is a rare condition in newborns, and they will get it if their mothers who have a certain autoantibodies. This can cause rash, liver issues, and congenital heart block. Lupus can be really hard to diagnose because the signs and symptoms often mimic other alignments. Now I'm going to be talking about some history of lupus. Lupus was first discovered in the 12th century by a physician named Rogerius. He called it lupus because in Latin it means wolf. He described a skin condition with facial lesions that look like wolf bites. We now described it as a molar rash or butterfly rash. In this time, lupus was just considered a type of skin disease and not connected to systemic illness. In the 19th century, physicians classified lupus into different types. Two of the main types of lupus are lupus vulgaris and lupus erythematosus. In 1872, Maurice Capozzi described more of a systemic form of lupus erythematosus. This was the beginning of identifying systemic lupus erythematosus (SLE) as a distinct form of discoid lupus. Through the 1940s to the 1950s, Hargraves and his colleagues discovered lupus, LE cell. This provided a breakthrough in diagnosing lupus, and the LE cell became an early tool for the laboratory. In the 1950s through the 1960s, there was a development of tests for anti-nuclear antibodies, which is also known as ANA, and other antibodies deepened the understanding of lupus as an autoimmune disease. During this time, treatments began improving. In the modern day era, the advances have led to more effective immunolating therapies, biologics, and better management strategies. The research into genetic, environmental, and hormonal factors contributing to lupus have expanded significantly. There has been a huge increase in awareness of how lupus affects women and people of color. This led to more targeted public health strategies. Signs and symptoms. There are many signs and symptoms, and as I stated, there are different types of lupus, and some have different symptoms than others. Symptoms also come and go in flares. Usually, an early diagnosis is critical because lupus can be mild to life threatening. The general symptoms are fatigue, fever, and unintentional weight loss. What can happen to your skin and hair is across the cheeks and nose, you can have a butterfly shaped rash. After having sun exposed, you can develop skin rashes. And if you already have a rash, it can get worse. You can develop a discoid rash, which is round, raised, scaly patches on the skin. Lastly, you can have hair loss called alopecia, and it can be due to inflammation or lesions. In muscle the musculoskeletal system, you may experience joint pain, stiffness, usually in hands, wrists, and knees. You can also have swelling of joints, muscle pain, or weakness. With lupus nephritis, you can have inflammation of the kidneys, blood in urine, protein in urine, and high blood pressure. Neurological and physiological symptoms could be headaches, memory issues or confusion, seizures, and mood disorders like anxiety or depression. Cardiopulmonary symptoms would be chest pain with when breathing, shortness of breath, and irregular heartbeat. Gastrointestinal symptoms can include nausea, vomiting, abdominal pain, and liver inflammation. Blood and immune system symptoms include anemia, low white blood cell count, low platelet count, and increased risk of blood cells. You can also develop painless mouth or nose sores. So, causes. There isn't an exact cause for lupus, but it is believed to result from a complex interaction of genetic, environmental, hormonal, and immune system factors. Genetic factors. So first I'm going to talk about genetic factors. Though lupus isn't directly inherited, there is a genetic predisposition that plays a role. Certain genes increase susceptibility. People with a family history of autoimmune diseases are more likely to get lupus. Next is environmental triggers. This specifically can activate lupus in genetically predisposed individuals. The first being sunlight exposure, and it can be triggered. It can trigger skin rashes and flares, infections, viruses like Epstein-Barr virus, which is also called EBV, may be involved. Medications and certain drugs can induce a lupus-like condition. Exposure to chemicals like silica dust or cigarette smoke, and stress or trauma like physical or emotional stress may trigger or worsen symptoms. Hormonal influences. During childbearing years, lupus is more common in women than men. Estrogen may play a role in immune system dysregulation, and flare-ups are sometimes linked to menstrual cycles, pregnancy, or hormonal therapy. Immune system abnormalities. Lupus involves autoimmunity, and this is where the immune system mistakenly attacks the body's own tissues. Defects in immune regulation like T cells and B cells dysfunction can contribute to inflammation and tissue damage. Drug-induced lupus. Certain medications can trigger lupus like symptoms, but once the drug is discontinued, they will go away. Hydralazine is blood pressure for high blood pressure, procanamidine for heart rhythm problems, and isoniazid for tuberculosis. So next we're going to talk about the pathophysiology. The pathophysiology of lupus involves a complex, dysregulated immune response where the body's immune system mistakenly attacks its own healthy cells and tissues. This will lead to chronic inflammation and damage to multiple organs. Genetic predisposition. So, like I already went over, certain genetics play a role in lupus, and what these genes do is contribute to abnormal immune regulation and make the immune system more likely to react inappropriately to the body's own antigens. The environmental trigger, as we know, also the UV light, viral infections, or certain drugs can trigger lupus in genetically susceptible individuals. These triggers can damage cells, which lead to release of nuclear antigens into the bloodstream. Loss of immune tolerance. The immune system usually ignores self-antigens, but in lupus, the immune system tolerance fails, and the body begins producing autoantibodies, which are directed against self-antigens. B cells are what produce autoantibodies and is often with help from dysregulated T cells. Formation of immune complexes. Autoantibodies bind to nuclear material and form immune complexes, and these complexes circulate in the bloodstream and deposit in tissues like skin, kidneys, joints, and brain. Complement activation and inflammation. The immune complexes trigger the complement system, which is a part of innate immunity. Complement activation leads to inflammation, recruitment of immune cells, and further tissue damage. The complement levels are often low during active lupus flares. The multi-system involvement. The immune attacks and inflammation affects multiple organs. The skin causes rashes and photosensitivity, joints with arthritis, kidneys with lupus nephritis, heart and lungs with cirrhosis, brain with seizures and cognitive dysfunction, and blood with cytopenias and clotting disorders. So some risk factors of lupus is more common in women. Lupus affects people of all ages, but it's most likely diagnosed between the ages of 15 and 45. Lupus is more common in African Americans, Hispanics, and Asian Americans. So, some complications. So with kidneys, lupus can cause kidney failure, and this is one of the leading causes of death among people with lupus. What it can do to the brain and central nervous system is if lupus starts to affect your brain, you may start to experience headaches, dizziness, behavior changes, vision problems, and even strokes or seizures. It is more common for people with lupus to experience memory problems and also have difficulty expressing their thoughts. Blood and blood vessels. Lupus can lead to blood problems such as anemia, which is a reduced number of healthy red blood cells and an increased risk of bleeding or blood clotting. It may also cause inflammation of the blood vessels. What it can do to the lungs is when you have lupus, it can increase your chances of developing an inflammation of the chest cavity lining, which can make breathing difficult. Pneumonia and breathing into your lungs is also possible. Heart, what it can do to your heart is this disease can also cause inflammation of your heart muscles, your arteries, or your heart membrane. People with lupus are also at risk of cardiovascular disease and heart attacks increase as well. Infections, you are more at risk and vulnerable to infections because both the disease and its treatments can weaken the immune system. Cancer, this is a small risk, but lupus can unfortunately increase chances of getting cancer. Bone tissue death, this will occur when the blood supply to a bone declines, and it will lead to tiny breaks in the bone, and eventually the bone will collapse. Pregnancy complications, when women with lupus have a high risk of miscarrying. Lupus also increases the risk of high blood pressure during pregnancy and preterm birth. Doctors recommend for women to delay pregnancy until their disease has been under control for at least 6 months to reduce risks of complications. So, how to diagnose lupus? When it comes to diagnosing lupus, it can be difficult because signs and symptoms vary considerably from person to person. The signs are the signs and symptoms that the signs are symptoms that can also change over time and overlap with many other disorders. Not just one test can diagnose lupus, there is a combination of blood, urine tests, signs and symptoms, and physical examination findings leads to diagnosis. So first we're going to talk about laboratory tests. So a complete blood count test. This test measures the number of red blood cells, white blood cells, and platelets, as well as the amount of hemoglobin, which is a protein in red blood cells. The result may show you have anemia, which is very common in lupus, and a white blood cell or platelet count may occur in lupus too. A erythrocyte sedimentation rate. This blood test will determine how long the red blood cells settle to the bottom of the tube in an hour. A faster than normal rate may determine a systemic disease such as lupus. This test isn't specific for any one disease, and it may be elevated if you have lupus, an infection, an inflammatory disease, or cancer. Kidney and liver assessment. So blood tests can assess how well your kidneys and your liver are functioning. Urinary list. This is a sample of your urine, and it may show an increased protein level or red blood cells in the urine, which may occur if lupus has affected your kidneys. An ANA test, a positive test for the presence of antibodies produced by your immune system, indicates a stimulated immune system. If you do test positive for ANA, your doctor will most likely advise you to do more specific antibody testing. So for imaging tests, this test will be done if lupus is affecting your heart or lungs. So you can get a chest x-ray. This image may show abnormal shadows that suggest fluid or inflammation in your lungs, or an echocardiogram. This test uses sound waves to produce real-time images of your beating heart. It can check for problems with your valves and other portions of your heart. For biopsies, like we talked about, lupus can damage your kidneys in many different ways. So in some cases, it's necessary to test a small sample of kidney tissue to determine what the best treatment might be. This sample may be obtained with a small needle or through a small incision. In some cases, a skin biopsy is done to confirm a diagnosis of lupus affecting the skin. So for treatment, so depending on your signs and symptoms will determine your treatment. Since signs and symptoms flare and subside, your medication and dosages will need to be changed. I will go over the most common medications used. So anti-malaria drugs, these medications are most commonly used to treat malaria, such as hydrochlorine, and it affects the immune system and can also help decrease the risk of lupus flares. The side effects of this medication include upset stomach and very rarely damage the retina of the eye. Regular eye exams are recommended when taking these medications. There is corticosteroids, prednisone, and other types of corticosteroids can counter the inflammation of lupus. High doses of steroids such as Meterol are often used to control serious diseases that involve kidneys and brain. The side effects of this medication include weight gain, easy bruising, thinning of the bones, high blood pressure, diabetes, and increased risk of infection. The risk of this medication or the risk of side effects increases with higher doses and longer term therapy. Immunosuppressants in serious cases of lupus, drugs that suppress the immune system may be helpful. And here's a list of some of those medications. The potential side effects may include a increased risk of infection, liver damage, decreased fertility, and an increased risk of cancer. Biologics, this is a different type of medication. It's going to be administered by intravenously, and this is also reduces lupus symptoms in some people. Possible side effects will include nausea, diarrhea, and infections. And the Ritu mix may be beneficial for some people where other medications have helped, and the side effects are allergic reactions to intravenous infusion and injections. So some alternative medications. Sometimes people with lupus will decide to seek alternative medications. Though it doesn't alter the course of lupus, it can help ease some of the symptoms. Before trying any of these medications, it is recommended to check with your doctor first to see if they'll interfere with your current medication. So first is DHEA. Taking supplements containing this hormone along with conventional treatment may help reduce lupus flares. The side effects include causing acne for women. Fish oil is another alternative. This supplement contains omega-3 fatty cells, and they may be beneficial for people with lupus. Some studies have shown promise, but it does need more studying. The side effects include nausea, belching, and a fishy taste in the mouth. Acupuncture is another alternative. This is a therapy that uses small needles inserted just under the skin, and it may help ease the muscle pain associated with lupus. How to manage lupus? So it's recommended to see your doctor regularly, be smart in the sun, get regular exercise, don't smoke, eat a healthy diet, and take vitamin D and calcium supplements. But it's recommended to ask a doctor first before you take those. Coping and support. So the challenges of living with lupus increase your risk of depression and related mental health problems such as anxiety, stress, and low self-esteem. Learn So the first thing you can do to cope is learn all about lupus and gather support among your friends and family so you can have support. Take some time for yourself and connect with others who have lupus so you can go to different groups, therapies, or just connect with someone who has lupus. The prognosis to this disease is the survival rates are more than 90% of people with lupus live 10 years or longer after diagnosis. Many live a normal lifespan, especially with proper treatment and regular monitoring. Quality of life, effective management. Many people with lupus can lead active, fulfilling lives. However, chronic fatigue, joint pain, and flare-ups can limit daily functioning. So with good prognosis factors, early diagnosis and treatment, mild disease without major organ involvement, good medication adherence, and regular follow-up care with a rheumatologist. Poor prognosis indicators is lupus nephritis, central nervous system involvement, poor response to treatment, high disease activity scores, and delay in diagnosis or inconsistent care. So the epidemiology is for the global and regional prevalence. Worldwide prevalence, it is estimated between 20 to 150 cases per 100,000 people, but varies significantly by region and population. The United States, it's about 1.5 million Americans have lupus, and the prevalence is approximately 70 through 100 per 100,000 people. It is more common in Black, Hispanic, and Native American populations than in whites. Other regions, Africa and the Caribbean, have high prevalence and often more severe diseases. Asia and Latin America are increasing in incidence possibility due to better diagnosis and urbanization. Europe has a lower prevalence than in the US, but varies by ethnicity and country. The demographics are for gender, 90% of lupus patients are women, and it is most common in their childbearing age, which is 15 to 45, due to hormonal influences. Ethnicity, more common in Black, African American women, and Hispanic, Latin, and Asian women also show a higher risk and often more severe. So for age, onset typically occurs between 15 to 45. Childhood onset lupus tends to be more severe. Late onset lupus is after the age of 50, is less common and may present differently. So the incident rates, global incidence is 1 to 100 new cases per 100,000 people per year. US rates is 5 through 8 new cases per 100,000 people annually. Rates have increased slightly in recent decades due to improved awareness and diagnostic tools. So for a famous person that has lupus, first I'm going to be talking about is Nick Cannon. There has been a lot of awareness brought to lupus, and a part of that reason is because of famous people getting lupus and talking about their experience. The first person I'm going to be talking about is Nick Cannon, and he's an entertainer and a TV host. I'm starting with him because it is very common in men. It is very uncommon in men, but him having it shows men can get it, and it gives awareness that may make other men that have lupus feel better, because this disease is mainly, the people who have this disease is mainly women. He was diagnosed with lupus nephritis in 2012. He has made a big public impact because he has spoken candidly about his kidney issues and hospitalization. He uses his platform to educate others about living with lupus and managing health. Some of the symptoms he experiences fatigue, swelling of the knees, trouble breathing, and kidney pains. This caused him to seek medical attention, where he was later diagnosed with lupus. In February 2012, he was rehospitalized with a pulmonary embolism, which is a clot in the lungs precipitated by his malfunctioning kidneys. He has totally changed his diet and prioritized getting the proper sleep since his schedule was super busy. He had to leave his radio show on CBS. He also exercised 5 times a week and is down to just a handful of medications a day. Nick Cannon had no family history of lupus, and he connected with people who have lupus also to get more answers about it, including Tony Braxton, who is a famous singer. He has lots of support from his friends and family, and he says it helps him remain optimistic and hopeful and full of faith. So I'm going to be playing a video about Nick Cannon talking about his experience with lupus.
I take my testimony, or I take my test and turn it into a testimony, ultimately. And I say it's one of those things where it's made me stronger. It's definitely, I feel like I'm in better shape, better health than I've ever been before, because it's allowed me to pay attention and focus more on my health, and making that a number one priority. And at the same time, I say I have lupus, but lupus doesn't have me. So I'm one of those people that want to wave the flag and say, hey, you can win this fight. Advice that I would give to anyone with this condition would be just to take it one day at a time. Some days are harder than others, but just to persevere, fight through it, and make sure you do everything that your doctor tells you to do. There's many things that I would love for people to know and understand about lupus, but ultimately, like that, it's not over when you hear it, when you know someone who has it. It's something that you can definitely get through, and you can win with any condition when you hear when you're not knowledgeable of it. Not only yourself but the people around you can get filled with fear, but it's probably more the more you know about it, the more you can understand it, and the more that those fears go away. It's important to spread awareness about lupus for a few reasons. I mean, mainly, the more awareness, then the more people are familiar with the disease, and a lot of the misconceptions about lupus can be cleared up. But then, even more importantly, when you create awareness, you can also raise the proper funds for more research and better medicine, and everything from getting everyone to understand that we are looking for a cure ultimately. So it's everything from clinical trials to so many things that when you teach people and allow them to be aware about lupus, it helps further that mission.
So that was the end of the video, and I think it was very encouraging to people who have lupus, and it gives them more motivation. So next, I'm gonna be talking about is Selena Gomez. Selena Gomez is a singer and actress who was diagnosed with lupus in her early 20s in 2023. Selena has brought so much awareness to lupus, and is personally how I found out about lupus. She is constantly talking about how her condition and the things she goes through. She also has brought awareness to the mental health and emotional struggles a person goes through when being diagnosed with lupus. She had a kidney transplant in 2017 donated by her friend Francia Reja, who is also a famous actress. Selena was in remission from 2017 to 2020. But in 2020, she had a flare-up, but since then, she is back in remission. Selena is constantly talking about the things she still goes through, including how weight can go up and down because of medications you take, and how people need to stop shaming people if they do gain weight. By Selena doing all of this and speaking about all these things, it makes people feel better about their condition and they can have someone to relate to. Especially being a public figure, a lot of people view them as perfect or they have it all. So seeing a star going through this can really show it can happen to anyone. Selena Gomez is really a remarkable person because she has even started her own makeup brand, which is Rare Beauty. This brand makes sure packaging and products are easily accessible because some medications with lupus can cause your hands to shake. She deals with this personally. She stated she always been drawn to packaging that's easy to open, close, hold, and apply. Rare Beauty is inclusive for everybody, and she created this to make everyone embrace their individuality and redefining beauty standards. This brand is also deeply rooted in mental health and um, ad- advocacy and self acceptance. The Rare Impact Fund donates a portion of sales to mental health in initiatives. Lupus really affected Selena's mental health, and she's a huge activate on that. So awareness, May is Lupus Awareness Month. This started in May 2009. Purple is a visual symbol for Lupus Awareness Month because it is a positive color to motivate people to keep fighting. Was made to raise funds to go towards research and to bring more awareness to this disease. And that includes my slides. And yeah, thank you.